Ghana for Madaroma mode share sase babe no ahobrasi mu a dodo na ne yaye eba no apomunse apamu ayare semuni apomuden nsi aka no me nyina si prekope ne de pese ye nyina ye wia amenji ni senka fie na bia ba koto ba de nti ye kokoto ba fie na bia ne se ye kakra ne ya sese ahwe bebia ye duru ne ya ye bia ka ho ene bebia gina yi hwan ene ye gidi se obetumi de yakọ abato no so koto a onyina so ne se penifo mienu no kakra na wo de hye o monsa no ekwan be no mutumi e de fa so Ghana ya pomun's dimunsem ne ya yaresa ho nsem pass ye ka ho nsem a and I always say it and be bi share obi ameka say there is no doubt say between NPP and NDC no NPP ya wadwempa ne mapa bebre mo my way na eto de bia nipa hofo no eti say wa hwani na wa nto boase a bon say ahofo na bia ema wo de eteki decisions bi ba eduma pa de a bed say your opponents between the omo atoto yen embra MPP edikan ye ba mu on my way mu aya former president Kufuor or survey between 2001 and 2000 that was the first time Ghana ha promodin hu sem bebre health financing ekwan fa so ye hwe na promodin hu sem Ghana yaresa Ghana fo tumi ekomanim no opampenin Kufuor epege mu health infrastructure o mampeni Kufuor epege mu o make sure say ansan ye bedu 2008 no December no na Ghana bibia obeto ya pomodin nsem in the year 2001 no na akone nimbebre. But like I always say, where MPP won under President Kufuor took this country in terms of health delivery no anka ye bomodia at that time in the year 2009 anka yan fall for propaganda any twist any spin at that time anka ye pija ye ho kra ko prekope than where we were because by the time omampeni Kufuor kono na niema MPP 1 year na anka ye set ye ho on the part of growth and the health no na 8 years na ya no bedi ye no no ma say ni nyina and I'll prove that to you tonight. Me prove a friend is saying, sir, points that me making to you tonight. And the point is that we as a government, as an MPP government, as an MPP political party, on every ground from health infrastructure to health financing, we have done way better than the NDC ever did. In fact, Omampeni Kufuor's administration is focusing on upgrading healthcare infrastructure. That was one of the focus. EBCC hospitals, ACC clinics, ACC CHIPS compounds, ACC polyclinics. If our hospitals or buy an enkoye or refurbishing or uplifting, he put a lot of effort in ensuring say medical professionals on training and to keep them in this country, or bema omo kankwa kwenim sene be ya bebre na beka edu bedu kan beka ya na o my way. A lot of our medical professionals, they didn't want to go into the hinterlands. Rural communities. Omampeni Kufuor had to put in place a lot of interventions to ensure say they are attractive for them to go. In fact, he put in place a lot of campaigns and interventions. Not certain diseases and illnesses be an how my way. He had to do so much work to ensure say before Omampeni Kufuor ebeba abetena konyaso na NPP abetena konyaso. If you recall, on my way mu na maternal mortality statistics on maternal mortality. In fact, that was a time you'd realize say your kind budget parliament mamifo ene ye mamenom dodo a eko awoso mu ye no finance minister begina parliament na wabobo na wakase oh afi de ade o na percentage we yen than the previous percentage. That is how bad our health system was, and it was purely based on one reason. The reason was that we had a very poor system in this country. Say wo kwako wo unisika obetua doctor no ana hospital no real time obede fie nti na awofo ne bebre ye ma menum bebre no awo kana odade mu odampa so ochem obechema kopem se moje tunu ama ontumi ye ho hwe na fe de America se de ne hospital wahwe ni obedu na obedu hospital no no ma hwe omonkwa nti ema quack doctors ni omo mogigi awo fie ni nkrasa na ebedoso. Why? Because the cost was too much. That was the days of cash and carry. That were the days and now crazy I want to be in a hospital and it cost a lot of lives. In still bet. In fact, at that time in this country, I walk hospital a country and then pipe. And on my realizes that we cannot run a country like that until quickly, the free maternal care a buyer. And what free maternal care basically did was that making sure say on my way mu okwakowa ehun yasa obe physical prekope na ode akọ hospital akwako aban etua saka no emaw se ne be ya wankasa obetumi akọ without any difficulty. But monkai bibi the same people omoni e prayer konwe ne yanu omoni e prayer konwe ne. When this free maternal care was being introduced at the time ayedeba on my way, they said it was not possible, but we did it as a country. And on my Peninkufo at that point realized, if we are going to improve on our health situation in this country, then it's not just infrastructure, it's not just putting up training schools, it's not just training doctors and nurses, but we need to ensure that health financing is dealt with once and for all. Send beya si yakase on my way ya pomodin hu sem ko animu health financing so eka on my afini ye hyase asa 2001 mampinin ko for by na Ghana on my way o ekotodwenim or how bebre na dey so a lot of people were struggling to even fend for themselves in a day. And so this kakro de beko ayarsabia and so ye the cash and carry. That was the time I said oko na okonya accident na ye foul every accident in the Dukodu hospital na doctor for dem sa tutu botom na omo enyeska adebechi we nisu bete na o wasamando wewu because you needed to pay at all times before you are taken care of. And then Omampeninkofo decided, say no, we had to introduce a national health insurance scheme. And this national health insurance scheme no significantly changed the face of health delivery in this country. Is a deadly cash and carry system na NDC for jatana on my way consono. Free ho. And for the rest of our lives since that time till today, no, the lives of our healthcare delivery, the lives of the Ghanaian person when it comes to health services access, no, has never been the same. But of course, as usual, like it always happens, when the national health insurance was being introduced, no, these same people, these same NDC people said it was not possible. In fact, at the time when your parliament, akoko pray, a friend is saying, akoko pass a bill for the National Health Insurance Act, no, boycott here. In some baby no more they said we are just almost say MPP for year to turn foot good penny and yeah they are so until we introduced it. They said so many things. They put up across so many things. This is them. The minority boycott proceedings on health insurance. 31st July 2003. The minority in parliament had decided to boycott federal committee proceedings on the national health insurance, which began on Tuesday. And they were telling us at that time, say, the decision to boycott national health insurance, was in the interest of the people of Ghana, and that they are protecting our interest and defending the interest of the people of Ghana. This is what they said. And there are points, and they say, on my Niska at that time, I had the health insurance. Inti, omo form nka ho. Ade intina MPP abanbeka say before my Nisika. Na ye de tua Ghana ni bia obekọ hospital so okopa yare say de tua no hoka, so they will not agree, so they will not support. Let it be put on record tonight, like I said on the next chapter show, it's fact only that in the year 2003 ana MPP abansi ye the national health insurance eba at the time na cash and carry kum Ghana for at the time na cash and carry say on my way ehwe yasero NDC for 31st July 2003 Thursday minority boycott proceedings on health insurance. Reason they say protected the interests of the people of Ghana and defending the interests of the people of Ghana. Why? Because according to them, mining nisca to their health insurance, and that any possible that say mine betunia for nisika now Ghana ni biya area our cost person need to yanaka almost any possible to member so into they didn't want to be part of it. That is what the NDC and their followers did to us in the year 2003. They even went on. The NDC accuses government of deceiving Ghanaians. I say the National Democratic Congress on Tuesday accused the government of deceiving Ghanaians on the National Health Insurance Scheme. The party said the government was in haste to pass the bill because the pressure from the IMF to fulfill the agreement has reached with the fund to include a 5% increase in the VAT in 2003 budget. To achieve this, the NPP imposed a 2.5% VAT on petroleum products. Hence, the near 100% increase in the price of petroleum products announced in January 2023. Moses Asaga, spokesperson for finance. So this is it. Omampenu for the NPP about who say adenti na yare Ghana ni sorti bumpurugu se ote sugakope se ote asin so ote twifu praso na wako ayaresa be nyumi ameno ka say awoti fie ubusu ni bi ebia owe krum na ne ho aka na empofrim ese de ne ko hospital according to the NDC no ese nipa ne wo sika hye ne ho obetumi di akọ hospital na wetumi de tuaka anye saa dia emeyefa o mine sika nhwe o mabenu ko fase de bi ene sei ade ne yemo bia contributing kakran ne yefam bebom ne yefam to foto bi mu se ne be ya se wo yare a na wokọ wan yare a ye de wo so foto no wo so de na ka obi ho ene po ankasa de ne sa tu botomu wokoto nsu a ye de kakra vat kakra to so wokoto jena ye de kakra to so na etumi aboa na Ghana ni bi eti bebi etumi nya ansa because ebusuafo dia ye ko be nyina yi ye nyina be gya tum se bebi eni wa esen ayaresa school nya ensen ayaresa eduma nya ensen ayaresa ye cheche sika ma okra emu nya esen ayaresa. Everything we are doing, the ultimate of everything we are pursuing as a country, to ensure say we have an efficient, effective health delivery system that would ensure say wo aname and ayebusu eni bi ho ka immediately no ebetumi ahwe no. But the NDC kicked against it. That is how bad the situation was. And to what be, if you pay close attention to the NDC that we are seeing today in 2023, you'd realize that they 2003 almost yet different from the NDC we are seeing in 2024. The same people. So you see, and yet and kicking against the policy view. It is out to say NDC4 are kicking against free senior high school in 2016, 2017, 2008. And many young woman, omo nananum saa no ye 2003. Omo ancestors saa no ye in 2003. It is so massive for you be in 2024, 2023, 2017. You should not be surprised. And remember what they said in 2003. They say omo kicking against national health insurance because they were defending and protecting the interests of the people of Ghana. And these are the same people causing all manner of difficulty for this country in parliament. And the same phrase we are defending and protecting the interests of the people of Ghana. Now look at this. 2008, 5 years later, after they told the people of Ghana say health insurance, MPP ain't to me yet. MPP say chenchina ye be ye no almost say and we ya if so be no so ye mamu kwan na mo introduce e friend say VAT na ye fan ye health mo be into me nya so faso. 5 years down the line the same people when afedi omo who say Ghana for ni age health insurance no cash and carry free ho mamefo e kwa wo so e ko ni free nkola dodo a ewu awo mu e kofem mamefo a omo wu awo so e kofem Ghana for pomudin sem na ya resasem e kosro no all of a sudden quickly ye kotoaba August 2008 akabaya 6-7 months we about to obaso Into NDC for now, almost kicking against health insurance. No, this same group they come back and they say NDC to introduce once for life insurance premiums. Can you imagine the hypocrisy, the inconsistency, the contradiction, the deception, and tro and kontopo and nada? Koko football bo subai no efri omo nananom na abedu omasefo aye kan wonsem. So you see the connection. Enti enai say what is NDC ni catch us say oh free SHS na you say 2008 ye demonstration tia no 2008 ye advert makomako 40 tia no ene omo catch us say oh yes mo free SHS no ye gitum oh ye ni free SHS no ya adwen montuma yes mo ye ba ye fa ye sanka. The people who said they will cancel free SHS, the people who kicked against free SHS, the people who said free SHS was not possible. First almost say enya the papa ye bo mo dey the buy na fe do mo say ade no kra enya fe afi do mo say quality no kofam exam results ni buy na nkola na ya ade no afi do mo say o nkola no kro mu wi aye. The same people now akabe 6 months ekotoba omo nam nkrase omo nam efiefiem afi do mo say free SHS no kra de ye say ye ba ye beto aso ye beye the same scenario na mentwe madwen ko bribi so eto de bi na ye ka bibia enye se bia ye pese ye ka ne ye ka kekeo ye ka kire mo say the NDC kicked against free senior high school. So if they come and tell you say on beto aso boboa me do ye change in the year 2008 after NDC had kicked against national health insurance, they came back almost signed by BM on the catch Ghana for 5 years later because we say Ghana for near Jahon. This is free SHS ye the boy kiki against. I feel the one say Ghana for near Jahon. In Tomon na no so afide we beto aso. Ye the big crowd back home. Ye the private schools back home. Ye the way back home. They came to tell the Ghanaians 5 years later after kicking against health insurance say, I feel the oh I didn't cry money. E ma mo worry. Ye be ye ba health insurance na eba na ye kutia ye na ye se ye mpe no. I feel the monto abama ye sremu. Se mutuma ya ye be mo tua premium ba ko pe once pe utua untua biem. Omo yes our promise no in 2008. It's in their manifesto. Mr. Mu 8 years of NDC in power because it was based on some of these lies. And ye two abamomo. Ghana for we say health insurance ya the papa wu. Nemu ya na renewal so na premium no e hard dream 12 cedi 14 cedis no e hard dream nti no obi say obo be no one time there. Oh we mo no mo buy be yen form ntina nchen ne yen toma we mu. So we actually voted for them based on that. After we voted for them, Ghana for 2009 emba 2010 emba 2011 emba then Ghanaians got angry. Mobekaya and I go first started be say na health insurance one time premium na he mo share bo mo fambre because I can tell you without any doubt say Ghana for school some any of my yare sound some endiagro. They were very keen on it. And the Ghana for started to me say one time premium na mo share about 2008 no. Yes mo fambre. They couldn't do it. They were lying. They didn't believe in it. It was false. It was deception. Omu chantro. No mu yijide biom. No mu dada Ghana for. Enti afeno 2011. Ghana for pressure the course. Afeno omu say NHIS. Please go back. NHIS to be introduced as a NHIS one-time premium to commence. This is 17 November 2011. The one-time premium payment policy under the National Health Insurance Scheme will commence. The Minister of Finance and Economic Planning, Dr. Kwabena Dufo, has stated he did not give the specific date of the implementation, but it is certain that the project will be implemented by the end of 2012. Fellow Ghanaians, as at the end of 2012, Anyebia na NDC4 at the one-time premium abana. This is the Finance Minister speaking in 2011. 2012, they came to give us more promises. Return of cash and carry, NHIS is broke. This is December 24, 2013. Until by the time you year 2013, no more for one-time premium number. Almost health insurance. No. Until December 24, 2013, no. Now a lot of Ghanaians with the health insurance, the core hospital are useless. Now health insurance card, no. If I should be any so, and to me here, they collapsed it. The same people. Inti Osha sa tangent ya yekui. Na Osha omasi4 ene ya eni omo ewo ho ya. Ye de ya omo chehye yakwan ntumi yo mo hwe. Do you see any difference? Do you see any difference between the NDC in 2003 kicking against health insurance, and then 5 years later coming to lie to the people of Ghana and say, oh, I didn't pay. They one-time premium. What is the difference between Omasifo and Omodeli CCA? They kicked against free senior high school, fought free senior. In fact, NDC for denigrating Omagu free senior high school mufi SCOBI or my room. Then to 2024, Yakotwaba, Omagu said Ghana for only John. All of a sudden, they are promising us an enhanced free SHS. The people who said free SHS was nonsense. The man actually told us, say, "Ono no kra 2 billion cedis anka. Oh, from Korea secondary school education free." He said it. It's on video. And then wasiaba. And you made Dennis. And you made miracles. And I made that TV so the man catch her say, "I didn't know all cannot dada woo. Me chira udi anina nanum eye. 90% of Omomudi said Jumedi Ebony from 2003, 28 to 2008, 2011, Bepimone, Omomudi Saboni by fighting free senior friends and fighting national health insurance and coming back to deceive us. Said they were going to make it one-time premium and having 8 years and never do it. You know, they are all part of the same group. Difference, the same people. So today, if they come to you and come and tell you stories about all the fights they fought against education, and now come and tell you, say, they all of a sudden believe in the thing they fought against and say they will never invest in the judgment is yours. They can't be trusted. They cannot be trusted. We cannot believe them under any circumstance. At the end of 2008, Omampeni Kufoni NPP are buying based on NDC phone training contemporary the buy NT. Ya two about TIA, you know. At the end of 2008, non-national health insurance can't afford to do a waso. Answer Omampeni Kufoni connect 12.5 million. 12.5 million. Ghana phone Bakumako 12.5 million in an Omukran national health insurance card or medical hospital. It tells you how important this policy and program is to the people of Ghana. Unfortunately, by the time I am promising a one-time premium, I ain't am I a 2 about 8 year a buy now or the other buy another will be mono. By the time I almost in 2016, 8 years one time premium no bed that I may 2 a buy don't buy no. They didn't do it. 2 no more kuno into 12.5 million no. Now membership no reduce it from 12.5 million to 11.3 million. Almost 1 million and now a free health insurance because now health insurance already no obekaya news na me dey 2013 it was completely dead. Card in the ukura wo by the hospital useless. Now I can tell you and I'm pleased to announce to all of us say the confidence level in the national health insurance no kofo asefo kofo ma yesan baye later 8 years later yesan baye no yesi abe pega na nu nyamu and na me no kase as a matter of fact, as a matter of data, facts and figures, national health insurance enrollment no a pega equals 17.5 million. Into which you better at 11 million. Next year they almost about 6.2 million. And they are become into Ghana for 6 million. And it will be GDA the current health insurance system and into Omakoji Kada so the difference between the NDC and the MPP when it comes to healthcare access, creating healthcare access, creating the space for the Ghanaian person to access healthcare no clear. Yen nanom ene omo nanom hia in 2003 no ye yesin omo ye twa omo ene yasefo okofo asefo ne omo so masefo be hia no difference no eni yasan etwa omo. This is our scorecard when it comes to the national health insurance scheme. Ghana for the door omampeni kufo ejaye 12.5 million okono na omateso about 11.03 yabaye no enuma ya ye ne. And let me put it on record, enye niema ye pese ye about health insurance nyina na yetu biye still there are teething challenges and teething difficulties, I can tell you that. But still, in spite of all the difficulties and challenges with the scheme, the difference in terms of your delivery and your acquire yama health insurance card who are na cost no very clear. The confidence level that the Ghanaian person has in the MPP's health insurance versus the MDC's health insurance, no, obvious. And then somebody kaya, and I'll play a video shortly. I'll play a video for us to see how Ansana MPP are buying me second one. Yebeba be na Ghana for every and so much to renew national insurance card. When you are in a hospital, maybe a way few into your card now expire at once, and say call back to cash and carry because it was going to take you about 3 weeks. And so what you may renew with health insurance card. In Komobi, how would you need heading? As someone in the Muken, what would if you are wishing? You are very much aware, say, some Komodiano need DA and heading. Everybody knew, say, before 2017, now we can renew health insurance card. A manual, over could be line, by one, friend is saying 2, 3, 4 hours. Now to all say productive economic hours. And so what you renew card, and no 3 weeks. And so our card died on Saka, and then instant. Digital, short code. In fact, what the doctor now and nurse in any OPD now on no casano. Say, or file card, na say, one, say, hey, we have fear, some renewal. Mr. Mama, 30 seconds.
These people have been queuing for hours to sign up to Ghana's national health insurance scheme. A new instant biometric membership card is proving very popular. The scheme was introduced 10 years ago and there are now more than 10 million subscribers. It means access to free healthcare and medicines for those most in need. Vida Shewudiaso is waiting for her child to see the doctor at the country's largest hospital, Kolebu. She's been using the National Health Insurance Scheme for 7 years. She says it's been of real benefit, but is not efficient.
At times you can get here at 8 a.m. and then you have to go to the insurance desk, fill out forms. All these waste time, and sometimes
it's being compounded by Ghana's deteriorating economic situation. The government hasn't paid its bills to those providing the service. This is one of the busiest pharmacies in Accra. They serve nearly 3,000 health insurance patients every month, and they haven't been paid by the government since the beginning of the year. It's a similar story for this private clinic in Tema, just outside the capital, Accra. The medical director says he's struggling, but he continues to see health insurance patients because he doesn't want to abandon them.
It's very difficult for us financially. Because the last payment was about some 5 months ago and we haven't paid our salaries. We have a lot of interest to pay in banks.
The boss of the National Health Insurance Authority says the government is committed to paying those providing the service, but that the scheme was too ambitious to start with.
For a lower middle income country, it's quite challenging. Challenging, one, because our benefit package appears to be quite huge, covering over 95% of disease burden in the country. Perhaps in hindsight, we could have begun with a more modest benefit package and increasing this package as we got along.
The scheme is financed by a national insurance tax of 2.5%, plus an annual flat membership fee of around $6. It's won international recognition for bringing free healthcare to millions. However, critics argue it's not sustainable and that it's hard to see how the service can remain viable unless people pay more. Amma Boateng, Al Jazeera, Accra, Ghana.
The National Health Insurance Authority introduced the biometric registration to effectively link facility attendants to claim management and also deal with the duplication of card holders in the subscriber database. Since the beginning of the biometric registration in the Northern Regional Capital Tabale, over 2,000 clients have received an instant ID card. Women and lactating mothers during their visit. Some subscribers say they had to queue for days and longer hours to be able to access the service due to frequent disruption in internet connectivity.
It hasn't been easy because I came here as early as 7 a.m. and I'm still in the line.
Tabali, and this is the health insurance situation. Very good. Very good. Ebusafo enya me ena meka enya me ena me de mano eka saa nsem we. This is a video that was done years before NPP eba abemu biemu in 2017, and that was the health insurance situation. That was the situation. That was the situation. Enti se yeka apomude ho nsebo a ense moma nyina ye clear say they are training nyina ne tenten ne tietia e apomude. And if you get that wrong, almost everything would go wrong, and we need to protect it. And health insurance no entwema dwemba bibi so yare dodo na health insurance shase na me fa ne say eye on the policy a ehwe no from 2016 and this from yare ba kokora meka ho na che say yare dodo na o yare do a say yare bi wo ha na health insurance ro kwa enkoba ni ade ntie so we dey enka ho no for 8 years. They did not introduce even one additional illness to it. Nti the member to ye na mutina ho anti yare ahodo na ke say ye ko eri na epia ba so nkakra and me no ka say under this government ye cover 95% of diseases in this country. 95%. About 95% of diseases in the country is covered by the National Health Insurance. Na Mr. Mo, and then you the kidney abeka ho, and then you the childhood cancer abeka ho, leukemia, worms tumor, sickle cell you so mu eduro bi you the man kola na sen kola no odi eduro no mo a etumi boa na yare no mu nya seasons ni ade edi bi ma me hwehwe di na membo na enyi hu what's the name of this hydroxy urea. Let me share one for me. Hydroxy urea. See the deal. We doctor for the better here. Hydroxy urea, and this hydroxy urea no area very crucial and critical. Can say you to me the ma and Quran all this about we never did. And then Yamincha de Yamia Daroma. A binder moto about man 2017 no. Ebusiafo. Omo money ye pray and say into about mo zero man for the anka ho. And then ye the kidney in collect below 18 years. And in Pennyful war above 60 years. Moya aware to say Ghana ha in collect 18 years and then the draw super they are covered under the National Health Insurance. And the dialysis near they are covered. Cancer in collect edu baby. In fact, much more pictures, images kakra. Mr. Images we know kakra inti mo fancheme. But moment say images kakra. Ni tias ye pa what it means for these people who can now have access healthcare under the health insurance scheme. Nti wo hwe enkolai ne yare sronku yi a se oyin ni ba ewo ekrasi baby na akole yawe but omo sign screen pictures ni biom akole yawe se ne ba enye ne photo true no photo of his ne ba ewo sa yawe bi na health insurance enkoba. What is this parent going to do? What are people like this going to do? What are parents like this going to do? Citizens of this country who find themselves in this situation, what would they be doing? It must influence our decision in voting. Because about one room, and yet one sending panel board cancer natural bush for. And yet one is our kotuaba, then the panel say, we no kasobe, pen went to me, and went to me into Mufamami. Now, unya who quite say, Oba Bayano, what is zero in the buyer? On the way to me, I now, but on the 1, 2, 3, 4, now baby come. No think of 10. To me, ye 10 year no credit, but why 4? We ye 0. Inti man ben can't say and say, when to me 10 inti for my change say, or ye 4, but we ye 6, or ye 5, but we ye 7. That is what should lead this conversation. And yet, did you? And yet, Casabasa ninety mo name, Casa tree name, Penify, Casso many debit. Purely based on the facts. Yes, say, and you know what health insurance we need to me. Nemum, see a share health insurance and common dear. The part do I have former to so and health insurance. But no, there are some hospitals cry a buying sick is here to come on in young koye, a delay, kakra, a biakachi. It's true, it's there. But you're improving them. And my confidence that hospitals in the scheme no a cost row. Inti born at the days to say I'm share 2013 Al Jazeera video ya in Kofoso Moko Hospital NG and our choir line 3 weeks and so began the card no. And then confidence in the cost row into hospitals no or more J card no share. There are companies and first use private health insurance schemes. And then it's on the confidence level in health insurance inti use Ghana health insurance in the mom workers. Inti yen can say the money na akoye because there are hospitals a bicycle say konini nyankoye. Inti there are those challenges. But the hospital need say a by way I improve this system to the extent say obetumi deliver service no because government is surely going to bring them the resources. And inti na NDC for ba be mu no o mampeni ko for jane 12.5 o mo tse so call 11.3 because we share video no here. People are tired, they are stressed. Say me the renew card na me did 3 weeks there and me ko gide and a card no so me the call hospital na say in JDA then what am I going to do until they started dropping the health insurance card and living their life in the hands of God. And until the man numbers say no esoti no and then you buy based on the confidence into 6 million Ghana from Akuma 6 million data doesn't lie 6 million and a confidence for more health insurance in no akosro nti omo de omo ho abedom adentia niam ni be say yare dodo health insurance ne cover no ye de bia beka ho NDC fan for bia nka ho enti of course if there are 6 million people who feel say there are diseases that they would need cover for omo nyina aba beka ho. This is a government that cares for you in spite of difficulties, in spite of challenges. It's a government that wants to be there for you, a government that acknowledges that we have difficulties, but I want to be care for you. I'm telling you, I want to be there for you because I know we have difficulties, but I want to be there for you at a point of need. Private health insurance schemes no ko check say mudu do say na sa yare we krom card ne hwe. Private health insurance na ewo ho na bebre na private companies ya de kono, they don't cover these sicknesses and these diseases, but your government, the government you voted for to come to office in 2017 no, has brought this. Now this person that was keeping people 3 weeks before they can get their card with you auntie under the NDC no ya born perfume now card yes want to go hospital this of 3 weeks na 3 weeks be one no card no for so be no also and then instant. That is a big difference. Under the NDC, oman fa ya res fofo bia mbeka de omo beto from oman penin kofo ho no. Ene ya the kidney abeka ho, ya the childhood cancers ya ria a ba wan hwe betumi ahwe wase nyina ahwe we japade nyina ye de abeka ho. Enu nti na numbers na Ghana for do a omodom health insurance no ababeka ho. And this is our scorecard for health financing in this country. We are the big conversation, health infrastructure. We provide health care near the we provide finance near the at the biggest question is health infrastructure. And if I say yare bowa obeko, and if I obako pay ayarisa, and so extremely important. But maybe a fee video be very, very important. A told be a Okasana wa Okawasema as a wawutu. Next chapter, yentu yehu, ye data and facts and kwanekasa. Moment hemami, Ghana ni ono, AD health insurance ye babeto ye no wa dance. Ye share no cross ya tuanko modie no so.
Edano medemebano ko hospital. Oyale esada heya. Me ko emi ni se me kwa kotua card me ya so de ma renew ne health insurance. Me ko aya no na ga na ji oso de buy me see ai. Oji your hair so say akola no ofie se me so 4 years. Wasi abeya adwuma sisi a. Kwa aya adwuma ya henda Ghana no etu omu ye ba omu ya beba omu ye ba omu ya beba o ye ba omu ya beba
enti o hwe mami ya ono e kanasem e fa dance die no na 2024 dance die no yento ba for progress yento ba for future yento ba madota Mahmoud Bawumia na onfa insakra sonko a ebema Ghana for ho atomo embra peni de yankasa we peni papa na esa ho chene o hawo mawo but the difference between a good leader and a bad leader ne say baako ho chene ba no de nsa ko wiem me a dead goat me odwemfunu minti obia e de amoka na me beti de ampa bia monye me mfa me ho peni papa no kendini papa no one de ho chene ba oka ni peni nyina ebum eboabo ye nyina no no say o hawo na ba amane hu na ba aha no metumi agumu kakra man yetumi akoyenim once we pursue the challenges and make sure that we fix them. A good leader is not the absence of difficulties and challenges. A good leader is a leader who, in the midst of challenges and difficulties, has the courage to mobilize the people and drive us out of these challenges into the path of prosperity. That is what Dr. Mahmoud Bawumia represents. That is who Dr. Mahmoud Bawumia is. And that is why confidently we are saying, let's vote for Dr. Mahmoud Bawumia for the sake of the future of this country. Health infrastructure. The records of the NPP government when it comes to health infrastructure, NPP 1, NPP 2, are unparalleled and without doubt. And I'll tell you why. NPP are buying yes scorecard in here when it comes to health infrastructure. Yes, scorecard in here from 2017 to 2024. This is our scorecard. Number of hospitals, 12. CHIPS compound, 1,737. And you know, say Ghana ha. Yeah, health center 5, polyclinics 15. When say Ghana ha, yeah, health system no, yashe. At the basic level, at the electoral area level, is the CHIPS compounds. Hono, ena say uti paiwo, uyuma ka okakra, uhodo do, ude meka na obeko. Uko do wana say a bro CHIPS compound for the swa, na ye de woko health center. Uko do health center for no so na a bro muswa. Na ye de woko clinic. Uko do clinic na bro clinic for no so a ni ye de woko polyclinic. Uko do polyclinic na polyclinic for so ntumi handle ni ye de woko district hospital. From the district hospital and far ni ye de woko regional hospital. From the regional hospital and far na fi de woko tertiary hospital se Kolebu mu de keka ho. The number one most important and crucial health facility in here Ghana Nubia and the CHIPS, because and first point of call, and so it's very important. This government has really focused on it. In fact, a lot of even government institutions, government enterprises, almost social responsibilities, they are pushing it into providing some of these CHIPS compounds and health facilities across the country. District assemblies are building it. In fact, National Logistics Authority, they are always building health facilities at the CHIPS level, at the electoral area level, from the GMPC Foundation, Ghana Gas, just say several of these state institutions, National Health Insurance and Kasakra supported districts maybe to build some of these CHIPS compounds, and this government has built a lot of 1,737 of them. Okay, can Myanmar projects are by way a year within the health infrastructure space 2043. This is a scorecard. In fact, agenda 111, and I will go into the agenda 111 specially very soon. And see, we are very confident about what it is that we are doing as a government. Without any doubt, we are very, very confident about what we are doing as a government. And that is why, you see, based on the IAE, and based on your scorecard, dinti, mo sheso na mo fanto aba emayen. These are some of the projects several of them in so-called hospital. And you see, there are some of the projects I bet in NDC for say complete fabrications. Plenty of them are complete lies. And I'll tell you, President Kufuor in the year 2008, I share project BSA. Or share the Eurojet projects, I say. You say, Eurojet. Bebrena etas na ndisi for tutu futuro no market cansem, and I'll tell you something this evening. President Kufuor somewhere in November 2008 share Eurojet project ase. Now the Eurojet project, basically all it was doing is to ensure say certain health facilities will be provided across the country. Certain health facilities provided across the country. NDC for buy, you know. NDC for buyer is also much as our project and so on. For the 8 years that NDC remained in power, between friend is saying 2009 up to 2016, no, almost project in Egu, Emma Kufuor asefo, answer yes sign buyer, answer yes sign buyer, ebe yes our project, and it's quite painful and quite sad. Say, in spite of all of these things, you know, you still hear them. Still, I better say more kasa bebre, cancer markesi bebre, and these are projects that they should have finished in 8 years. At some point in Pono, sika omo koji yes omo family some of these projects, you know, omo diverti sika no, and the sika no koye election, friend is saying research, and we'll come to that. That is the kind of people we have to deal with. And you better make omo ankasa emu muton no omo de kasa ansem no, and today these same people will come and talk plenty. Yes. Every government provides some infrastructural intervention, but I can tell you without doubt to say what this government has done. What this government has done, it's way more than what the NDC government did. And I've actually shown a lot of these things. In the table that I showed you. It is important, say, on my say. Who provided health delivery amount you pay attention to two critical things: the financing part of it, and then the infrastructure part of it. We fix financing, no? Now we fix health and so. We fix financing, no? Now fix health and so. And it's important that we keep our eye on these things. And we believe that as a government, we believe that based on all we have done and based on all we have tried to put in place for health infrastructure, no, we have absolutely every reason to believe, say, this government should continue to finish what it is that we have started. We should continue to finish what it is that we have started. And these are some of the pictures of hospitals abaye ya intervenir to me I provided for us across the country. Infectious disease center Cape Coast. Hospital. A lot of these facilities. There's a East District Hospital. There's a polyclinic at Segi. Polyclinics, we have about 10 or so of them scattered all over Greater Accra. This is the Krobo Hospital. And also is there. This is the Buipe one that I was referring to. And several of these interventions have been put in place to ensure say empo say won touch ma ana won ka say wa monko bie say wa de na mame monko bie say wa de na mame say wa didn't say Sewa, where Konongo, but Sewa. Look at the Sewa Hospital. They want for an amazing edifice. This is a project that you can see you 80 years. 80 years, now come more being some. They didn't touch it. They left it. Kufuase for, and a sign koya and buy and a sign be sa and this tells you the caliber of people that we have to deal with. Like I said, on the next chapter for us here, it's just the fact and nothing else. And so once we put the facts out there, it is up to you to take a decision where you want to go. Say we should move towards the future, and the future is Dr. Mahmoud Bawumia. In 2004, and this is a very, 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 very worrying situation. Mobekai May 9th disaster. May 9th disaster, just as it happened in under COVID, when we realized that we had over 88 district hospitals, only FNSN hospitals. May 9th disaster here in 2001. That was when this country realized that we had an extremely poor emergency system. The emergency systems, you will say at home it doesn't even exist. In fact, we did not have any emergency system at the time. Until the year 2004, and now Oman Peninkufo Eshasi, and again MPP. The same MPP government had to come in and put in an intervention. And in 2004, the National Ambulance Service piloted operations with about 69 newly trained emergency medical technicians. In fact, that was the time and we were trying to put in place a completely new system to ensure, say, Ghana, Yebenya emergency system, and Oman Peninkufo piloted this with about 69 newly trained emergency medical technicians, 9 ambulances, and 7 stations. As of 2017, MPP na Ghana, we had only 55 semi-functioning ambulances. Not just say, your ambulance mako 55. But some ambulance 55 for the crampono, and ye 55 years. We go worried. Now don't go further realize that hey, we cannot continue like this. So throughout his campaign in 2016, he started talking about ensuring that we provide this emergency, we put in place a solid emergency system for the country. And that is why on 28th January 2019, Nana Adakwe Akufo-Addo commissioned 307 new ambulances. One constituency, one ambulance. Say, anya she krampono. Ne pape muno enkese se dosu sinsa. But 55 for bebre na ye dwuma nkra de alabraka. Anya she krampono constituency biara no. Ese nya ambulance baako. Na afa bigger facilities to say kolebu ni ade no. Yenya ambulance na dodo. Into 307 ambulances and Omampeni Nana Adakwe Akufo-Addo introduced in 2017. In fact, say o calculate now share the number of ambulances Omampeni Akufo introduced here. Now o share baby ani yewo. Now imagine say it took the same MPP. Omampeni Akufo-Addo best started ambulance service for the record. As a matter of fact, Ghana National Ambulance Service of the Republic of Ghana was started in 2004 by the MPP government. For 8 years that the NDC were in power, they did nothing to improve on the ambulance service. It has taken the same MPP government to come back 8 years later, and then in 2019 come and continue what Omampeni Akufo started. That is why. And maybe Amekache must say, let's allow the MPP to finish what we start. Because if we had continued from where Akufo left off in 2009, and Kabiyesi Assembly, in Kewebe 1,000 ambulances, because it had to take us to come back 8 years later before we could put these ambulance services together. Muhe video we mami.
Each of the 275 constituencies is expected to receive an ambulance by June this year.
The health delivery system will be significantly strengthened by the expected arrival in June of 275 ambulances, i.e. one per constituency, to make treatment of emergency cases more effective.
President Akufo-Addo says each of the 275 constituencies is expected to receive an ambulance by June this year.
The health delivery system will be significantly strengthened by the expected arrival in June of 275 ambulances, i.e. one per constituency, to make treatment of emergency cases more effective.
How do any bushes from Con and the mine? No crap, and say, with the bush and so. Never in the history of this country have we had any government, apart from the NPP government. Think about the emergency services of this country like we have. Imagine in the middle of the night at 2 a.m., 3 a.m. Now when you're emergency, now we need ambulance or district in the then put ambulance or a hospital be there. Now we pay mwa see ebe foul. Yeah, what new year? Obadwin say asama making e we chichi na wo de entumento. See a share numbers no. Ni share nipa do ambulance service eba from 2019 be pemu ne. Afibia eboa it will tell you what we were missing for 8 years, the gap we created in 8 years. Gap we created in 8 years and now yama MPP abayan to us. Every ambulance service na yashas you know. It will tell you the impact. The number of people who lost their lives, the number of people who could not get access to emergency services because we didn't have ambulance systems, proper ambulance systems in this country. Districts do not have. The whole region, region in ambulances, by 2 and 3, is the regional headquarters. That is how bad the situation was for us as a country. In fact, within NDC 8 years now, we attempt to say, we provided some form of mobile emergency support. No? Domo kofa ba eni kai ai si wi anye bia we no mo hwa. But this is what they did. This is what they did. They didn't fix the emergency health system. Rather, what they decided to do was to introduce a mobile clinic that cannot function. This is what they did. Meaning say we out in we woman temuda. And I won't put them we say NDC for car we or wha e dey emwe bi ebre oda. But this is what it is that the NDC did when we gave them the opportunity. Take a screenshot we na print it na fashe frame na for board mu okotoba 7 December my win kai na kai say enye nyoma ni nyina ene yeye yetumi aye nemu se ka win ko ade a anka mama yentoa so na yemfa nepa emra ambulance emboa e de abrɛ no o me hwɛ video yi.
Ghana's public health system had been lacking many things, including emergency medical services. In the Ashanti region, one case that became very topical and has stayed with both paramedics and regional heads is how a pregnant woman carrying twins and in labor got saved, courtesy the National Ambulance Service. Central Front Plains District Chief Executive Joseph Jimfi Owusu first made that call to the National Ambulance Service on behalf of the distressed woman.
Ambulance afibia, in fact, average 28,000 cases an ambulance service handle. In Tebusia, this I say, Sanipa 28,000 ambulance abuomi. Say, and yet MPP are buying ambulance, one constituency, one ambulance here they buy here. What would have happened to these people? Please take a deep breath and ask yourself this very important question. Why did we wait so long Why did we allow this to continue for so long before we brought the NPP back? Why? President Kufuor started this. There was nothing like a national ambulance service. President Kufuor started it with the NPP. The NPP came to you. We begged you. We asked you to let us continue. Why did we allow the NDC to deceive us? Then we voted for them. And then for 8 years, we had to endure. Painfully enough, we don't have statistics of the number of people who lost their lives because there was not a proper emergency service in this country. We don't have that statistics. Painfully enough. But if we had that statistics, we would have realized what we missed for 8 years. 28,000 every year. What would be the fate of these people but for the emergency services that President Kufuor introduced? Now this is it. This is it. 2009 to 2016. NDC are buying. Increase stations from 128 to 130. Let's just say 8 years. 8 years are the 2 centers in the count. 8 2 centers. 8 2 centers. No more the count. MPP. You're moving from 130 to 275. Yeah, there are about 145 new ambulance centers, new emergency centers in our Ghana emergency services and all. Between 2004 and 2016, if you have President Kufuor NPP buying share national ambulance service, I say, 2016 and NDC are buying a free so now the total number of ambulances and look at semi-functional. It's a honey who be you near there 55. I'm not going to for the Daroma. NPP are buying Daroma, and as a country we boast of 307 ambulance services, and that is why 28,000 minimum every year are able to get emergency services when they need it, in the middle of the night, daytime, in the morning, in fire, rainstorm, to ensure say lives are saved and lives are protected. Responses. Not, in fact, every year we are, of course, because you have 55 semi-functional, you can only respond to 5,000 people a year. But you can imagine the number of people who needed help. Today, because we have 307 and more, no, 28,000 afibia are responding. And no ama Ghana me no say na your ambulance population ratio, one ambulance, a funny part 524,000. One thing here mpacho for pen. Ghana, as at 2016, na nipa 524,000, nipa 500,000 will be our ambulance back home. 500,000 will be our ambulance back home. But one thing you assign 500,000 no be our ambulance back home. And then yateso nipa 84,000 and a use ambulance back home. You go so quick. In fact, the global standard ne say nipa 25,000 ebe here a use ambulance back home. Into ambulance back home to nipa 25,000. And then yateso from 524,000 over 400,000 reduction. Yeah, they're about 1 to 84,000. Dr. Mahmoud Bawumia say, you better be aka ho, or the dodo na aba beka ho, or be shemukena. Na you to meet international standard no. Near if you 1 to 84,000 no. Nearby even below the 25,000. That is the next chapter of Ghana's emergency services. And some say, a good year during the period winti. The number of employment are now 1,651 no. And so to the about 178 people per any age within the ambulance services. And then Meno Kasei with a revamped, resuscitated, revitalized ambulance service, you increasing number of people here from 178 to 2,574. That is the scorecard for us when it comes to emergency services. Yeah, coming now. Now you another category and we hear power and also problematic, and I explain to you. Ghana ha somebody kaya na our credit to be shorted by your communities via it's a remote area more near DNT and I do not work no or call for no work no anti-snake venom na de be mana ne ho atono no ebi ni ho nti na o work obi no wu anajo a worker or bad time. You did not chips compound. ye na kwa health center ye kɔgye na wo odu ye no moje truna ma wa shoti moja ade ba ko pɛ ne saka obenya ye betumi esebi no anase ye benya no kwa eno eye moja esese onya na edisi ne so and I do the swim 3 a.m. physician assistant nurse wo ho oni moja oni yobeye from South community nim Echo District Hospital now regional hospital over 15 to 20 kilometers ne kwan ye enti on to me nko enti na waka Dr. Mahmoud Bawumia ni NPP aban say David we have to be creative si yen to me ye akwa nyina wie prekope ni yen to me nya niam ni nyina nya facilities amoja be wo Ghana ha electoral area bia prekope dia. Can we be creative? And that is the point I make all the time about having solutions in the midst of challenges. That, of course, as a country, we are unable to fix all our roads at a time. What it means is that it's difficult to transport people from certain areas in the middle of the night on time to get the needed emergency service. So what do? Do we just throw our hands in the air? You give it up, Debbie. Yam pe kwan sun kubi ebetumi afaso. Yenya ye wo kwan mpu se wo ho chewa ye betumi ahwe eno ene ma zipline ebaye na momi entie abra Dr. Mahmoud Bawumia ebo zipline so e che Ghana for
in terms of enhancing access to the delivery of public services in another 3 weeks time or less 3 weeks time we will see medical delivery by drones begin in Ghana of critical medicines and blood.
Zipline, ne say wo ekrabia say bebi ya ukro wo ewonsuo bi eja ekwan wom untumi ntu kwan tentem so a say wo health center wo clinic wo chips compound and District Hospital bi ehia moja na de agi obi nkwa empofrim na mekura mitfi ekwapem not tetekwashi shoti moja na se yehia moja na de agi nipa ne nkwa na se bi ni wa se e fa ambulance ni etu ambulance ne ban kan anase etu kokofodua ne yakofo moja na ba minimum of 30 minutes there ebedi ase abedun kan ye package wi as e de akọ until within 1 hour to 2 hours there ye bedi as amefa ne se BBAC ye kwa mu kra ye tuwenya moja aba be si nipa no so 2 hours until there are people who are definitely dying within that 2 hours because they couldn't wait for the blood and no and a zipline e ba bedu mujuma until we need the aba for kwan bi aba ye di moja no ebesi anoma no so buoni anoma drone buoni anoma ye di besi so na edi moja na bro obi awo bia na edi ahwe. That is all zipline is about. Se panye bi na esi ede wo na ebi ni ho a ye mfa ka emfa nko bibia nkoje ofre ewo app obo app no na zipline for the drone no ahye woni anoma no drone na edi abesi opon ano pe na ye de ahwe. Mama he drone e deliver niema and they deliver nduro e deliver moja ema some communities. Pacho mo sa video de mame.
The introduction of the zipline medical delivery services, some of the communities in rural areas are now able to receive quality medical services in time. The introduction of zipline medical delivery has positively impacted the work of health professionals in the area.
The LMD will request every 3 months. So after they deliver, if you need another drug, you have to wait for the next 3 months before you get it. But when zipline was introduced, things have been very easy. When we are in shortage of drugs or medicine, we just request and within 30 minutes we get them. But previously we didn't get any drugs, so we normally refer them to
bakukura mumbo video ya na nkola yi kwakogu mumbo sa video de mame enkola no ekogu wa nurse for kwakofa no mumbo sa video de mame na ekosi wa na chese ena besi wi ena dafe mi na nkola ya kwakofa na omudi akoma efeni say nurse for na nurse for kwakotam in a day for some hospitals, for some health centers, in a day almost to make about 3 or 4 different deliveries. and now me no say zipline you see built 6 zipline distribution centers you see bako omenako asante mampon vopsi sejuri also enum ene ketekrache ebia to be deliver nearby within 110 kilometers then 110 kilometers ebi wo mpa o na se baby awo bia within that space bia no enti e Ghana ha se na esi achiche mu no baby awo bia e beto be deliver emergency health service ayedai ama me na o ka say o can supply distribution centers in abomu a omo deliver 17 million for medical supplies to Ghanaians across 13 regions of Ghana. 17 million. It is only past 17 million. The biggest question is, say yes the plan and I didn't blow command and yes the plan and I didn't moja command now. And what would have happened to this 17 million on the medical bed? And so yadi adiebe muntie dia NDC for ekaye. NDC hanabisu muntie wankasa for wasutie dia hanabisu kaye when we were going to introduce the zipline medical drones.
If the drone that we all know, that I know that is what went and took the pictures of John Dramani Mahama, that has the cameras, and we have, and you are talking about women in the rural areas, then it means that we have a lot of roofless bathrooms. Last time, even in East Legon, I was shocked to find one by the hall where we launched our campaign, you know, for the by-election. And if a drone passes over any object and the person controlling the drone with a remote behind a screen, whatever the person sees, the person feels like clicking. The person click. Now, where is the privacy policy statement regarding this? You want to bring it into the country. The US that created it, where you're going to bring it from. There are women today who have taken people and some companies to court because once they were turning on the high seas, somebody's drone passing over them took their naked pictures. And so what I was saying that you use we women, I was addressing women. If that is it, now you should come out and give us your privacy. But if not, once I don't have it, once I'm not sure which drone is flying over me, I'll take it as the drones that also have cameras and they also fly and they take pictures. They may be going, it's a human being who is sitting behind the screen.
But you do know that not all drones have cameras, right? Cameras are only mounted on the drones. So
no, it's not for me. No, it's not for me to think. It's for the authority that negotiated to tell the tell us, and whether it even has it or not, you should have a privacy policy statement that accompanies it. So when it comes and violates my privacy as a woman, then I'll talk about it.
Aje Ghana for 17 million enkwa. Aje 17 million Ghanaians aje omunkwa. Na say women organizer of the NDC woka say drone no Ghana for mungu na de enti a eba ene say ebetwa emma ho ewe dware a. I keep telling us Ghana for health insurance me boche mo omukuti aye free teachers omukuti. Anytime I better say NDC for complaining about BBI MPP aban na say ade abebo Ghana for. It's as if they are on autopilot. I didn't buy a see a book crans ya dream. How can you sit on TV and say the medical drone here ya de musisi ya aje Ghana for 17 million enkwano. That medical drone no ya de aba because ya de behwe ma ho need to pictures. This is the peers person and the people who are moving from your house to house telling you to vote for them. And the decision is going to be made on 7 December. You have a reason to vote right or vote otherwise. Now, wambra adiena ye na ebua Ghana for edge Ghana for nkwano. Ono to humpi ma ho eseno no. Umentie the United States of America Vice President Okafa zipline na ye dia my way no. Muntie di okaye Kamala Harris. Umentie di okaye. Right now, Kamala Harris.
African nations are pioneering the delivery of healthcare supplies by drone. In Ghana, this service has delivered more than 9 million vaccines, including those for COVID-19.
Almighty United States of America vice president ebo Ghana baso say ade na ye no kra wiase afa na nyina no ye no any amine kakra bi na ye di animu a ye de gini pankwa NDC for Ghana say ye de hwe ma ho twa pictures zipline omo offices ni bi o menako office ni se hwe yo so die ni Vopsi die tie NDC MP or say NDC MP prefers motorbikes to drones for medical supply. Into say yare boy match 3 now pe moja to moto 50 baby awono now ride 15-20 kilometers na kohwe sempo moja wo ho a ansa wajibi aye den aba omo solution no into yeye solution say wo pe moja o anti-snake venom o pe emergency medical supply na bi ni baby awona ye the drone ebe shooty abroad in real time na dia hwe alternative na waba ho se to obama ne say on pen no yento motorbike na yenfa motorbike no enko so you have a choice to vote for drones that will deliver medical supplies for you in time of need, or you vote for the NDC for motorbikes to supply friend is saying medical need to you. South Die NDC MP Roxanne Dafiamepo South Die NDC MP Roxanne Dafiamepo the new Musemdi Roxanne Dafiamepo say ono ni solution na ono ni party omo de ba and say yemfa motorbike mumbra na nye drones we say you kasa tenten like I said next chapter yen kasa nti obia yen kasa ye career he until you have a choice to choose to make between motorbike and drone. And I'm very sure, very sure, say the millions of Ghanaians watching us this evening, you know, will definitely choose zipline drone medical supply system than a motorbike, because motorbike tete adwen tete nhyehyeye etwam enei efasobia entumi eniso when you compare to drones. So we need a drone option now and we use motorbike. But so we to be doing kind fa doing kese, you can think big. Now you believe in possibilities there. Then you can believe say drones are way better than motorbikes, and that's what we are proposing to you. UK's first medical drone delivery project will change future of national health scheme. September 8, 2022. United Kingdom, UK. Your colonial masters, no. UK's first medical drone delivery project will change future of NHS. September 2022. ye dear no ya ye wie kra no a yakoye nim no afi na United Kingdom for kra eba be bi. That is what Dr. Mahmoud Bawumia is proposing for the next chapter of the development of this country. Possibilities. Think big. Things that the NDC think is impossible, those are the things that the MPP believe it's possible, and those are the things we fight for. And then Ghana yatide dialysis abaye tuya eka na da kolebu ana ma omutumi provide dialysis support no ye fi ho. Parliament I approve 6.87 billion for national health insurance and financial dialysis na yen famboa na Ghana phone to nya dialysis support when it comes to those who have kidney, and we are all aware say on my way mu na say ade abapa and say what WhatsApp group we and say the flyer bia betum you say obi na wunim na hu na che behwe na na edna betum me ankasa menu aba me ankasa me cousin kidney ekunu, and there are millions of people are kidney aware how the body and all thing onto me inti nkoko hospital no dialysis na nkobetumi atena se yache but when ya m1 ntem I don't know why when ya ebetumi ahye wusika gida kra because I dey na wotwe bia esese wo ye why when ya ebetumi ahye ebe hye kra inti abai had to intervene. God being so good nyame ncha de abai na ohaw mu kra no still a opekwan obefa so de beboa ne manfo no MPP abano. We have come through for the people of Ghana again. We have difficulties. We have challenges. Of course, just like inflation, I'm sure. You go so I press every film. Exchange rates, you go so I press every film. And see, difficulties were, but in the midst of the difficulties, MPP is coming through for the needy. It's coming through for its citizens and the people of Ghana. That is the biggest difference between us and the opposition. That is what makes us different. When you video, you can say maba data and statistics and so. More for money and video. Videos will be one hard dream. Mr. Mo Fanchain, your couple with the ones that much video, mammy.
The humming sound of medical equipment here at the renal unit of the Cape Coast Teaching Hospital welcoming patients. It's a Tuesday morning and 15-year-old Priscilla Santi is being wheeled into the renal unit here.
The doctors told me I have to be on a machine, and I have to be on that machine either twice or thrice a week.
And see, based on how he and in fact we cry their back lebu back on for noche ne teaching hospitals. We bring na cash shefiu. We bring na cash demo because on okoko te say obetu ya 3,200 na what should be now ordinary ration home. People are dying because they cannot afford. People are dying because they don't have the money. But today things had changed. Abai Eden Sakayaba. Momenti announcement.
Vice President Dr. Mahmoud Bawumia has announced that the National Health Insurance Scheme will soon cover dialysis cases, bringing relief to many Ghanaians who struggle to afford their costly treatment. Dr. Bawumia made this statement during his campaign tour of the Upper East region, where he addressed various gatherings and interacted with the locals.
I thought it was very important to deal with the burden of sickle cell sufferers, and that is now covered. The same thing with childhood cancer, and childhood cancer is now also covered under the NHIS. One of the things that we are now starting to do, and the ministry, the National Health Insurance Authority is releasing some money for this, is to look at dialysis patients. Because we are seeing a lot of kidney problems that are in there for a lot of our citizens across the country. And so what we are aiming to do is to bring dialysis treatment under the NHIS, just like we've done for hydroxyurea for sickle cell sufferers and also the childhood cancer. Now,
based on Highway in Abainse Debbie, we are all trying to get ourselves from the global economic challenge, but we have to be there for our people. You have to be international, your man for whom you say, whilst and they are losing their lives simply because they say, so we intervene. And say, Ghana buying say, unya kidney, now we are below 18 years, sir. Kidney dialysis, I will be in Bosumini, no, Ibitia, obey free. Untiashe temesrew se wo fie na wo baby ehwaka kidney area ebia na wonte ya madaroma ene e free e chanopa fa obanoko nko e dialysis obetimi atena se ache no so contribute to the economy of this country ebiem se with the 60 years and above nso a with the 60 years and above nso a kwa e be show free untiahwe Nempu, mom within 18 to 59 years, Moko Konfanoche, whole teaching hospital, Tamale teaching hospital, Efian Kwanta hospital, no. 2 sessions, free. 2 sessions for you for a month, free. Timisel and foul kidney nation, what buy no, abem, Eden Shabe to a Koyama say, as old to me call, na Okoji Ayarisa. Na, I feel Umamoko Kolebu. And so no 50% of mo sessions na mo per month no so abaya fa ho ketu ya ba mo yes wachemu kana nka mebobu emu mienu na mafafa no mo tua ma. This is what a concerned government does for his people. This is what a willing government does for his people. It's difficult today in the world. Things are hard. Things are very difficult. No doubt about that. Every country is struggling to get back and trying hard to get back onto its feet pre-COVID days. But this government is saying that whilst we are working at all the other things, it's only 3,000 or the dialysis. Inti abaya for honka utuya ede amaye aban asanso aye urology and nephrology center of excellence and also eboa na ahwena kidi yawe edi huduma na menka se meso nchewo ye ka digitization enye abstract enye bibi e won frame mo kai embra na ye course hospital ye ko fill forms na o fill form bia na ya ma card na ye creative folder amount nti enei ukọ efie ekọ yie ewo krom ukodu ye no na wo yem ka wo ukodu hospital instead of say ye be me eduro ni ahwe ni awo wo pane no udu a afa ne yese ko fill form o fill form bia ko yi card amount na yakoye folder asa wo be wie na bibire kwa ha kra say ukodu hospital watena sia ma next fashion ama na ewu enei aban eyie free ho into district hospitals, regional hospitals, teaching hospitals. Abai epia ako akakra abai epia ako chips compound. Dia abai nyina ne se nei uko hospital e-health system no dia eye nyina ne se ote kasapin na uko hospital kasapin na oya card wo ho ne ye de uko system ni mu a eno ano no se wo be piem ewo keta na se yarebo na ko hospital de hia ne se obeyi Uganda card e bo Uganda card na wo information nyina ebepie na menka se ni nchemo what is anko money bida se obi enya accident na e do hospital no wa short moja na e se ma ne moja nso na wa ye unconscious ontumi nkasa watomum na ye nim ne blood type na ye nim ne blood group na fe ne ye ba betwe ne yakotese se mo nim sa de no ene I can tell you say with the e-health system no a year free ho enti e bia wo fi da mongu e na wo besen ko a year e wo twefo praso e na ukonya akwanhie bi ye rudu hospital ye yu card no ne ye hwe ne ye bo wo information na be ba system nim e wo twefo praso even though wo nko hoda udin wonfe wo blood group yare a wo ho endura a wotumi nom endura a wontumi nom allergies a wo ho bibia wa yare sa hu se mi wo BP wo akoma yare wo hu umoja mroso ni nyina be show e wo twife praso se de be ya sempo wato mum anade atowo so a yen ka se ye twe wo no wasori anse ye hu edu ede be mawo straight away ye be hu edu ede be mawo ye be hu ekwa ye be fa so ye be kra ne ya hwe. That is what the e-health system does. The e-health system say information unya enter no one pa bibi a obe fa Ghana half and nyina no information wo na nekura Dr. Mahmoud Bawumia registration at birth abeka on kwa dey fekeke because don't forget say nay you synchronize Ghana card with national health insurance card, you synchronize Ghana card with Senate card, you synchronize Ghana card with your tax identification number, ya synchronization in wie enti ya we nso ane ama Ghana card number sa number we and now the call we are afa na nyina enti ya we na ye test why you now blood group e the core system ni mu no enu nyia se ubebo a che doctor bia biem hospital bia obeko Ghana ha nyina no doctor no onye hu wo je Ghana card number obehu blood group no information na we hu kwa be fa so be den obehwe ye wie no Dr. Bawumia san the e-pharmacy so ba ene e-pharmacy adawoma uti wudem na wa to eduru ni ye deliver eduru na eden amaw ewo fie ebusafo se woto boase na okeka nyama ebu mu a na obehu insonso pa Dr. Mahmoud Bawumia na dan kwekufa ne MPP aban ede aba nyama ne de bebre na aka ye ntumi yeye dodo na aka ensem enyensiye ne mu se wukari na we na wo hwa obehu se de aye ne doso a ese ye bo ho ban na yetumi make sure say eno agire yie was to pursue the outstanding one. It's the impact of e-health going paperless and paperless okoye afi na okoye folder ne card ne menema improve efficiency. It's a man okos our hospitals here from health eduwa waiting time no and no so queues no enwa ama clinical research ekoye because your information data bebre you bet to be Uganda ha nipa do omunya malaria last month nipa do nya fever nipa do say nya say all at the same time because it's connected across the country and reducing rejection of claims by the national health insurance because first yes in a hospital be ye kunulu ebimu ye ketashi senti omo de ade ne kwa health insurance na che debi ene because of the e-health nti obi ehu obi ade ne hu bi untumi ye bibi amfa chiri nti aba eno so eboa na health finance eno so akọ entem afa aboa ema doctor for nurse for nyama pepe when it comes to protocols they say we save life like I said sadia tomi so ye the back hospital na say doctor no oni me blood group na say me yamoja just oto no bo ase na ba hihye nyama enei onya bo me information na me distance nyina ba nti time na nka first obe waste no da hihye nyama ni nyansa wa be hwe me no eni eso ate obetumi ahwe me ententem and now so no and this is a very important point track some core parameters which benefit our people like availability of empty bed into a e-health system hospitals are connected it's doctor all share now only say SM refer ko St Joseph no system nim onim mpa do a e wo St Joseph onim hospital e wo mpa any hospital eni mpa onim hospital e wo droway any hospital eni droway onim hospital e wo specialist way any hospital eni specialist way and that is the next chapter of Ghana's development. Dr. Mahmoud Bawumia say we need to finish this. This has to get to the church compound level. O church compound na wo community dem no. O church compound na wo ukromu hono. O church compound na wo ekradase hono. Ese sa church compound no so beka e-health system nim na yetumi nya na prakope. We cannot truncate this progress. We cannot go back. We must finish this. And that is why we need to vote for Dr. Mahmoud Bawumia come December 7th, 2024. There was special interventions bebre aban yi baye odiaba ekufo ado aban several critical interventions the notable pa University of Ghana Medical Center phase 2 ye ba aban mu no na Professor Mills ashas ye University of Ghana Medical Center but obaye no oye 1 pe oye phase 1 in fact phase 1 no omampenda da John Mahama betoye nti obaye no so betoa so ono kwa wenwie nti omampeni ekufado so baaya no wanto antwene se atamos de hyase na Mahama beto aso nti oto atwene na nadanko ekufado ewie phase 1 no prekope owie no amanan so wa o make sure say or the phase 2 no of the University of Ghana Medical Center no beden ebeka ho nti no ko University of Ghana ya ye phase 1 no ya bewie na ya sans wa hyase from phase 2 ekufado yobia and come for University of Ghana phase 2 ni see University of Ghana but on fa politics ending in Mkai. He could have taken that project to anywhere else, but to this University of Ghana campus war, just to ensure say University of Ghana Medical Center Numubetre, I enhance it in training of medical professionals. Now a center of excellence for our health facility. And Okowa kama almost contributing strongly to your medical tourism on my way. And again, also your second phase of University of Ghana, University of training of doctors, any other allied health professionals, no, akwedim. And abai also introduce training of specialists. And what this training of specialists in here say, one shortage that you work in the specialist healthcare space, my way no akwedim. Na adie bakwa then say specialist be a training no my way biano. MPP abai ayen free. Until all these specialists are being trained for free. We may have video quickly on University of Ghana Medical Center. phase 1 no before the buy the and a phase 2 no or send phase 2 no ebeka ho where your University of Health and Allied Sciences are na na dan koku for the phase 2 abeka ho a and no it provided the critical training for your health professionals ewo on my way mu na we project see aban we atamasi ho na wasan ahyemu kena na ebwa ebusafo we need to finish this. Let the NPP finish this. There are difficulties, there are challenges, but let the NPP finish this. Yeye we nyina yi omampeni hu kani your first lady Mrs. Rebecca Kufuado na ono so nam na obwa ode na ho den ta aban ni niku echi eye no ma hodo bebre ewo ye apomode ehonsam. And through various initiatives and advocacies, we championed maternal and child health, improved access to medical services, supported healthcare infrastructure development. Significantly, we contributed to the overall well-being of Ghanaians when it comes to the healthcare. Madam Rebecca Kufuado, the leadership when it comes to mobilizing resources, me municipal chief executive with Equiapem. Madam Rebecca Kufuado, Emma Equiapem not on my medical supplies be and then call at the health center x-ray machines machines be sisi wonyina Madam Rebecca Kufuado ena edema at the health center Tetekwashi hospital and several of our health facilities Equiapem not call Equiapem not as I speak to you she's putting up a CHIPS compound in one of the communities for the people of Equiapem North, and that is what she's also been doing. Or refurbish Osu maternity home. She's built Sunshine Hostel to accommodate children receiving cancer treatment. Any of my families, our Kolebu Teaching Hospital in Kola, and you can see cancer running through all the efforts that the NPP government, because it's expensive to manage. And if government doesn't support them, it will be difficult for them. The First Lady has built the Sunshine Hostel to accommodate children receiving cancer treatment. Any of my hospital or Kolebu. She's built the state-of-the-art mother and baby unit at Kofanoti Teaching Hospital. Constructed CHIPS compound in Kobebi, Nyanshegu, Kwaminum, Adankrebi, Biampa, Meme constituency Kra, Ibi Esiwa, Rebecca Ekufu Adro, Sunshine House. This is what the First Lady has been doing in the health sector to support the government and the people of this country. Umpewi. Na opeden mobeka 2020 wabra on my way afan into my pay fra ayesi kwampa so ayenam aye chese yeni age a. In fact 2019 is said to be one of the happiest Decembers we ever saw in this country, so many years before then all of a sudden out of nowhere you were somewhere February March you see your body be a friend of COVID. Nobody knew what COVID was. You need to cry and fire in but Ghana was adjudged one of the best countries, one of the countries that best managed the COVID situation across the world. In some other countries, people were dying. In fact, in some countries, at some point, they left people of certain age to die because there was no space to keep them. We shut down our economy. We shut down our country. We closed down our schools. Ghana, we had to recruit more health professionals when we had not budgeted for them and had no money for them. We had to incentivize our frontline professionals at a time when we had not prepared for it. Our economy and our society was disrupted. Now me MC, every baby no, yenam schools in the airport, which was a woman from dormitories and your isolation centers. Empo say obi ye asymptomatic and onya COVID no show symptoms. Near person isolated. As an MC, the district or the municipality, your top provisions, and they be an emano. Your man on a paduane, a viaduane, and a jodiani, a wonifie. Now, what top provisions now they are common. We struggled to ensure that we contain the COVID situation. Hospitals didn't have enough beds. We were using hotels to keep people. COVID, Emma say the much touted health infrastructure na NDC focus on my nano. It was a complete facade. So we don't see the gap that was in existence. COVID, and the man who say, hey, So my no 88 of your district need hospital. 88 districts did not have hospital in this country. Meanwhile, you say CHIPS compound, health center, clinic, polyclinic, and a district hospital. Every district must have a district hospital. Imagine this: a free Okre district assembly, what about Equiapem North, what about Equiapem South, what about Adenta municipality, now about Medina municipality. 1, 2, 3, 4, 5. All these district assemblies, we had only one district hospital, Tetekwashi Memorial Hospital in Equiapem North. And see, Obi Yare wa Medina, not per district hospital, not the Numachi Equiapem North, Adenta Equiapem North, Equiapem South, Equiapem North, Okre Equiapem North, and yet the Tetekwashi Memorial Hospital itself, the number of beds or one is so the pressure was enormous. During COVID, we realized that this country was not ready to ensure that we safeguard the future, the health of our people in times of emergency. We didn't have any, what you say, yeah, ready cry. Now, meaning say, yeah, you're if you COVID situation now, and I don't know if we have some videos on COVID that you may show. If we have, let's just show just some few seconds of the COVID situation, and then we'll come back to the conversation. Isolation centers, makeshift isolation centers, and now we had to create at that time. This is what we had to be confronted with. Government had to overspend, overrun our budget. It's just say we had to do everything we had to do to save lives. Our doctors and our nurses had to put their lives on the line. Your doctor for the nurse will be almost sure in the process of saving lives. We have families and friends. That is how difficult and how tough it was for the world during the COVID period. Countries like Italy, countries like Spain, at some point they were allowing people of certain age to die because only a friend is saying space and it was a difficult period at that time. It was a difficult period for us as a country. Patients were sleeping in classrooms. Patients were sleeping on floors. Children stayed at home for a year, and we still had to pay teachers and still had to make sure that these children had some interventions. It was therefore, this is what brought about the need to ensure that the call through 2020 no nyamin pengu obi nim there baby by a sign bar. We have to be ready as a country. Now the WHO crab boy abaso, you didn't see your video no and that pictures no but the WHO actually said when it comes to this country, Ghana, a quiet first way to manage COVID down a year strong. If I mention the WHO video no quickly.
The coronavirus pandemic so far, with Ghana's testing capacity especially singled out as one of the best in Africa. Government has received praise and criticism in equal measure for its methods in dealing with the crisis, with the opposition saying government has been slow. Well, the government has rejected that claim, saying WHO Country Director for Ghana, Dr. Nima Kimambo, has also been speaking exclusively to Joy News on this.
As you have seen, the government has been providing a lot of briefings on the situation of COVID. The daily numbers are shared, and we think this is a good thing for countries to be transparent, and the fact that even these numbers are shared daily on websites. The government continues to do testing, and it's also Ghana is also one of the countries that has done among the highest number of tests, and this is good because the more you test, then you are able to identify cases and you're able then to isolate.
Based on sa situation here COVID by NT, Nana Kweku Fado announced in the middle of the crisis, and that's what I keep saying. That is the biggest difference between the MPP and NDC. In the midst of the crisis, we didn't throw our hands in the air. Nana Kweku said, no, we cannot continue like this. We need to ensure that we fix this infrastructural fundamental gap once and for all. This should be a day. say the be in fin district in co district for obi enya ne de saa na ya hye health system no nti ya make sure so obi a obi na obi a de hwe ne mpotemu for because it's very painful say the what district A na me ho aka na me call hospital wo me district na e why ma because other people from district B and C aba so we needed to fix this. And so Nana Dankwa Akufo-Addo announced in the middle of the crisis that we had to ensure that we put up infrastructure at all the district hospitals 88 now on Manensi. We realized that there are certain regions in the regional hospitals in Jodeka, and also there are certain mental health hospitals also so that once and for all we can fix our infrastructure gap. This is the most audacious investment in our health sector when it comes to infrastructure since 1992 at least. No government since 1992 has pursued such an audacious investment like we have. Yes, as usual, just as they always say, Agenda 111, constructing over 80 hospitals at the same time is unreasonable, Mahama. Everything is impossible for them. This is the Garu District Hospital. Yaboso. Yaya fittings. Yaya finishing. This is the Abumosu District Hospital. Okre District Hospital. Okre the Miami Krum. And now Koha. Omaye installing beds, medical equipment and inside Nukra Dada. Achiase District Hospital. Akim Swedro District Hospital. Now the NDC are telling us say it's say 111 and I say 88 District Hospital. Yenti. But I can tell you, say, each of the 88 district hospitals are at different stages of completion. I'm coming say, Ena, or can see in 18 months. Let me miss a question. Tema West. Eka district no money hospital no. Just one hospital. But what they would draw in sir, Okwakosi district hospital we did Tema West. We do Tema West, we say Landa, Yadibeyas project no. Anyhow. Tema West needs a district hospital, but they don't have the land. So what would you do? You have to spend time to look for the land. It's all Tobas in our past. Some of them, like Tema West in Podier, it's an assassin Munti, Assassin Bejano, and yet can see it to send your plan is it no. Until I say, technical people no sign so much. No more sign best sad drawing no. No more draw building a best suited Tema West for assassin. What add there so? Upper West Akem. Ukosi District Hospital, Ukoyano, Assassina District in Mauno. There are rocks, big rocks in the land. So it takes you about 3-4 months before you're able to prepare the land and take off. Then, Ubiabe catch. If there are even some districts, if you can land, are you available? Then Ubiabe catch say, it's sad as our castle will be 18 months when we ain't. You are in Bugos. It was your for history. Will forever remember this government. That there was once a government that decided, say, district be a Sejane hospital. And the government went ahead to make that investment to ensure that every district in Ghana will have their hospital. Posterity would always remember this government. Na recruitment. As we speak, 152,472 health professionals in our byway, if 2017, EBA 2022 mpo, we are recruiting 152,000 every year. 2017 10,000, 2018 11,000, 2019 40,000, 2020 58,000, 2021 26,000, 2022 6,780, 152,000 health professionals. The aban yan say or per se ye a lot more health professionals ba na a reduce nipa dodoa ekobo peso eko doctor ba ko pe won nti enyi me no ka say doctor to patient ratio between 2009 and 2016 as at 2016 na 8,301 and it's the number of health professionals about we afa about a health system ni nti eko 4,992 emu ache mienu ye reduce doctor ba ko nipa dodoa ohwe do achemu mienu. That is the impact we are giving to our health sector. Nurse for 1 to 834 and then 1 to 524, almost about 300. And I buy at TF nurse back also. And now the nurse baby abede ababeka ho. No just call card no. Doctor strike is illegal. We can't negotiate under duress. MPP is recruiting. NDC is complaining. MPP is picking them. NDC is complaining. And 2016, a medical officer on the number around 5,200 salary. And they abaya to muko 3,406. What to mu first year house officer, non salary na be 2,800 Ghana cedis. And then abaya the kobe 8,800 Ghana cedis. Physician assistant now on the be 2,500. Abaya double no, oko 5,000 Ghana cedis. Registered nurse now on the number 1,900. And then abaya the ko 4,000 Ghana cedis. MPP abaya improve yen conditions no. Na Mahama mom warning say oni omo ni kase bia ni nkobodie bia oni omo ni bibia omo beka. That is the biggest difference between the MPP government and the NDC government. This is our report. This is our scorecard. 111 hospitals under construction, 6 zipline distribution centers that have so far provided 17 million Ghanaians with the needed medical support, 424,000 medical deliveries made by zipline drones as at August 2023, 3.3 million units of medical product delivered nationwide by the zipline drones, 2,694 health facilities onboarded on the zipline drone services, 10 million vaccines delivered by the 10 million 579 vaccines and a zipline drones deliver on my way. Hard to reach health facilities are in the zipline SAB on Krasi chips compound near health centers a way cheaper zipline a supply of Munyama over 400. Yet the ambulance 307 and Abba ambulance stations no yet the Bibri Ababe count about 297 and a Ababe count ambulance service response to cases economy preoccupy. National health insurance, a movie from 11 million, equal about 17.2 million. Ladies and gentlemen, this is our scorecard. This is why we believe we are a better alternative to the opposition. There are a lot of challenges, there are a lot of difficulties, but this is where we are. We need to protect this achievement. We need to consolidate these gains. And the person who would help us consolidate these gains is the flag bearer of the New Patriotic Party, Dr. Mahmoud Bawumia. Dr. Mahmoud Bawumia say, Yemano Kwai, na enepa ya shasi no, on fambe to aso no mewie. Yemano Kwai, na oma ambulances ni bi embeka ho. Yemano Kwai, na e-health system no, umbie mu na enkudu the chips level. Yemano Kwai, na doctor to patient ratio no, ye improve no. Yemano Kwai, na ambulance to citizen ratio no, yemfambra below the 25,000 global standard. Yemano Kwai na protected the health and the life of the Ghanaian. He is making a solemn promise to us. Say, there were difficulties, there were challenges, there were a lot of challenges as we speak as a country, just like all other countries. But he's making a solemn pledge to us. Say, in spite of these challenges, in spite of these difficulties, in spite of all the difficulties that we are in as a people, he's making a solemn pledge. Say, he'll protect our health. He will be there for us. He would ensure that no Ghanaian loses his life. 1, because he doesn't have money. 2, because there is no health facility. 3, because we didn't create the needed space for this Ghanaian person to have access to the needed health service. This is the next chapter of Ghana's development. Dr. Mahmoud Bawumia is promising. Ebusiafo, Machel, the scorecard. Very confident in it. No insult, no propaganda, no twist, no skill. Pure fact and numbers. I can tell you, say, we have done more for health than the NDC have done. It is a Okotuaba, now Koto Dr. Mahmoud Bawumia, and John Mahama, Ewo ballot papers. You have a reason to vote for Dr. Mahmoud Bawumia because you can trust him, you can believe in him, and you can be rest assured, say, Obe body aya no hobai na ODB ababeka. Echina, Yamiya Adoma, Dr. Mahmoud Bawumia ekopiemu ewa Ashanti region. Echina Juada, Ebnada, ene Wukwada, one Asanteman ebenyan kitangudie shronko, ewa ne campaign na oyenim. This is the 16th region awako, so far 15 region. I say no yenu baby ano. in Ashanti region on the Edwardifo Bedin Komo, on the magazine for Bedin Komo, on the Equiafo Bedin Komo, on the school for Bedin Komo, on the Asofo Beshia, on the Nanum Beshia, none Emrantian so Ebeshia, na ode ne dachi odwin ewo magana ode ama ye na no krepa ne se wodi we nato fema embra Dr. Mahmoud Bawumia eni abre a oye campaigner owura house to house door to door or campaign no na John Mahama complaining na ye kan say or complaining nti afedie o twasket nti se mo hu fiti andra on namabonten na microphone na ye de twa movie wo kuma wodo no tintintin no e bi da no so na obedu ho sa woton ade a na obegya na e de ji so ase oye skit na enya gro ni yedi Ghana dache ho nkomo eni yedi na mo hu 2003 e kwa mo de health insurance for so any 2008 promises on be yes on be one time premium o manje afi de omugu no kra mo mo ni tuya de omo ka fa free senior high school in 2008 bepim 2016 all of a sudden almost my U10 no. That's exactly what he's doing. Bibi ye dru no agoro na omudi pampempen so ye wo no enibre na aba. Dr. Mahmoud Bawumia is willing to work with you morning, afternoon, evening to ensure say Ghana ebe fan ntomopa ifra. Senior ye de bia no. This has been the Next Chapter show. Fact only. No propaganda, no twist, no skill. Yami Adoma Yawada 7:30 p.m. Yebishia na yedinko na sen yeti bia no kre no bebi edam yebefa na edi abechirem medam asibebre nyame hia mo sana dwi mo se mo mbre na moni mi atena ha ya hwehwe nsemu yebeye ni se ya kopem December 7 2024 nyame ye Adoma Dr. Mahmoud Bawumia bedinko ni na Ghana dachi etumi akonkan pepopo akram